New videos every day. Life, wisdom.
What would you say to the people who say, but the drugs work for me?
Well, the first thing that I would say, I would validate them. And I would say, I understand why you feel that way, because they do work initially for many people in terms of alleviating symptoms. Okay. But we're talking about short-term usage. We're talking about crisis intervention. Because if people were to do their due diligence and do their homework, they would realize that the vast majority of psychiatric drugs are only tried for 4 to 6 weeks in terms of their clinical trial duration. Mm-hmm. And people aren't placed on these drugs for 4 to 6 weeks. People are placed on these drugs for 6 months to a year minimum, usually. Mm-hmm. And generally, once they've been on them that long, they will develop some sort of dependency, or they will become addicted. And then they are a lifelong patient. Because as I explained earlier, long-term use of the drugs can exacerbate the very symptoms that they were given the drugs for in the first place. So where someone may have been initially anxious and given an anxiolytic, after you're on an anxiolytic such as Xanax or Valium or one of the other anxiolytics that's on the market, long-term, you can develop panic attacks. You can start to have anxiety between doses because you're addicted to the medication. Mm-hmm. And people do not realize that this is the agenda. I was in this industry. I have done my homework. And what I'm trying to warn people about is that this is an agenda that is a profit-making agenda. Mm-hmm. And they know that there are no scientific tests that are required to diagnose a person with a mental illness. All it is simply a third party's observation of your so-called maladaptive behaviors. Mm-hmm. And that individual is going to take those symptoms and match them up in a diagnostic manual that tells them that means that I have this or that disease state. Right. It is not a disease state. These are disorders. These are disorders that are voted upon by psychiatrists in a forum. These are not diagnoses that are scientifically proven by a CAT scan, by a blood test, by a urine sample. There is no physical scientific evidence. That makes it extremely easy for the pharmaceutical industry and the rest of the allopathic healing community to collude for money-making purposes. So if you think that they work, then that's fine. They do work for you. They work for you short term, but you are not everyone. Right. And there are a large number of individuals that will not even get short-term relief from the drugs, that will respond and react almost immediately to these drugs in a very severe way. Right. So that individual experience, they should feel fortunate that they did get any sort of benefit from the drugs. But I am forewarning them that long-term, they will be getting on my website, or they will be getting on your YouTube channel, or they will be looking for information down the road somewhere else when they try to undo the damage that has already been done.